Assalamualaikum warahmatullahi wabarakatuh. We are from Group 5. We'll be presenting on the topic Medicine and Maqasid Al Shariah. These are the group members that will be presenting on this topic. So let's look at the outline of the presentation first. We'll be discussing on the introduction of Maqasid Al Shariah, second, importance of Maqasid Al Shariah in medicine, and third is applications of Maqasid Al Shariah in medicine. So let's proceed with the introductions of Maqasid Al Shariah. My name is Nurul Christian Shara binti Muhammad Faisal with metric number 2017318. So let's look at the meaning of Maqasid Al Shariah. From Mufti of Federal Territory, Maqasid is the plural form of Maqsad and Maqsid, and it is derived from the word qasada in Arabic word that means toward a direction. While Sharia means water springs, where it is the source of drinks, spouse, what is sanctioned by Allah in the aspect of Aqidah, as well as rulings, the religion, and the opinions of Mazhab, which is clear and strict. Basically, Maqasid Al Shariah is the Islamic law that guides and gives benefits to the human being as well as to prevent harm. Maqasid Al Shariah is classified into three types, which are daruriyah, which means necessities that are very essentials element for a human being. The topic that will be discussed under this type, including protections of religion, protections of life, protections of lineage, protection of intellect, and protections of property. The second type is hajiyah, which means needs such as marriage, healthy food, and transportations. And the third one is tahsiniyah, which means luxuries, which are our desires, such as branded outfits, luxury car, and wealth. Next, let's proceed with the importance of Maqasid Al Shariah in medicine. First, the protections of religions. So, all Muslims are obligated to protect their religion, which is Islam, and preserve all the hukam or law that is belong to Allah. As related to medicine, the main purpose itself is to cure and to treat people from illness and any diseases. In Islam itself, we are told to taking care of our health, as mentioned in the hadith riwayat and Nasa'i. O servants of Allah, treat yourself with medication when you are ill, because Allah the Exalted has created a cure for every illness except old age. So our health is related to our ibadah, which is to free ourselves from any diseases so that we can worship Allah. So by protecting and promoting the good health and by protecting and promoting good health and medication can contribute to the protections of our religions. So a healthy body and good physical strength enable Muslims to perfectly serve Allah, such as to perform 5 times prayer, to fasting, to do jihad, and to spread good deeds to others, to read Quran, and to perform zakah. In other hadiths, we were told that a good body and soul come from good food. So it will be discussed in the next slide. So this is the issues in the medicines to protect to protect our religions. So in hadith that we are told to take good food. So that is why in Islam it highlighted the importance of consuming halal and healthy food in order to get rid of any illness and diseases. So when the body is healthy, then Muslim can be more focused in performing their ibadah and focused to serve Allah alone. If Muslim neglect the importance of the issues, thus we cannot perform ibadah properly due to lack of focus, due to pain, and due to illness. So that's why we separate the issues in terms of halal and haram. For halal, it is all the treatment from physicians, doctors, and medical experts. So referring to the above hadith, it said that people should take medications and try to find a way to treat illness by exercise and take medications as prescribed by the doctors and take healthy and halal food to prevent from any illness. For the haram issues, it is related to the all treatment that using prohibited alternative medicine such as bomo, shirik, khurafat, and whatsoever. So we can see from in our community, they are still using bomo to treat any diseases and any illness. So in Islam, we cannot do that because it is against Allah and it will give more harms to ourselves and to other peoples. So this is how medicine can protect Islam. As mentioned, the first protections of deen or our religions. So I'll pass to the next presenter.
Assalamualaikum warahmatullahi wabarakatuh. My name is Fatin Abraham binti Asman. So today I will be talking about protection of life. So protection of life. So Islam guarantees the right of life for every human being, whether they are Muslim or non-Muslim. So protecting everyone's life is a must to each and everyone. So to protect life, the Quran has prescribed that Allah forbid human to take the life of other human or even oneself. So since humans sometimes act against their own interests, thus the legislature made a strict legislation to punish the wrong act of killing, such as the implementation of the law of qisas and diyat. So in the punishment of the murderer, even though one's life is lost because of the crime, this will lead to saving many more lives, as the punishment will deter others from committing such crime. So what is qisas? So qisas is the equal punishment of what have done. So diyat is the specified amount payable to the heirs of the victim. So here we have internal necessities and external necessities. So what is internal necessities? Without internal necessities, we cannot live longer, which is include food, water, and medicine. So there are a particular time when in emergency where Muslim has permitted to apply concession, which is rukhsah. So example of the emergency is when someone was starving. When someone was starving and faced with death, it is permitted to eat and drink, which is haram, such as pork. So this way could help someone to survive, as life is very valuable to each and everyone. So external necessities allow us to live with dignity. For example, clothing and housing. So Islam demands us to always be moderate in every aspect to prove the strength and the excellence of a Muslim. This includes in clothing and housing. So that's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Hidayah bint Ali Suad, and I will present to you about the topic of protection of the progeny. So before we proceed, I would like to explain what is the progeny. So progeny is offspring or descendants of the humankind, and their parents that having the children, and the children is their descendants. That is the meaning of progeny. What do Sharia say about having a progeny? So Islamic Sharia only justifies procreation within the confines of a valid marriage. This is clearly stated that Islamic Sharia prohibits sex before nikah, or to be specifically, Islamic Sharia prohibit having children before nikah. So next, who does Islam allow to be married? So Almighty Allah incumbent us, all Muslims, to be married, but He prohibited it for those who lack of physical and economic facilities. What is the meaning of lack physical? So maybe the person may have diseases that cannot be treated, and economic facilities, lack in economic facilities means that the persons maybe have the financial problems. So these persons cannot be married. But if this person has extreme sexual desire, so the Islamic jurisprudence said that this person is compulsory to nikah, to marriage, because they are afraid that this person will do the maksiat, the major sin, which is zina. According to Imam Shafi'i, if his sexual desires are in control, then nikah is mubah. That is not prohibited, but this hukum of nikah is mubah for them. And then we proceed. Why protection of progeny is very important? First one, the protection of progeny is very important to produce Muslim leaders. Although now we have many Muslim leaders, but not all the Muslim leaders enforce the Islamic law. So the protection of progeny is very important to produce Muslim leaders that enforce the Islamic law to the world, so that they can be the Khalifah, the leader. And the second one, why we have to protect our progeny, is to produce the well-equipped generation. When we protect our progeny, we also protect their mind and all of their soul and body. So we can equip them for the challenging world by giving as they can solve the problems or challenge that they face by the Islamic thoughts and Islamic lessons. And the third one, we have to protect our progeny so that it to prolong one's life, so that it can increase the population. So how we can prolong one's life? So we can prolong one's life by introduction of vaccines on the infant. As we are aware that when we are children or infants, we have been introduced to the vaccines, for example, BCG and so on. This is very crucial and important for us to avoid the virus, the infection of the virus. For example, hepatitis A and so on, so that it can prolong the baby's life and can be grow to be a good Muslim. So the second one, we have to protect our progeny. So how we can protect our progeny? The second one, we can treat male and female fertility. As we know nowadays, we have very developed technologies, and this technology will develop day by day. So many problems can be solved by this technology. Include this treatment of male and female infertility, so that this female and male can also fertilize the egg, but in different way based on the technology. And the third one, how we can protect our progeny, is by taking care of the pregnant women and children. Nowadays, we have introduced to many products and technologies, and this can help to take care of the pregnant woman and the children. For example, the MM Essential, the milk, can give enough nutrition to the pregnant woman, also to the children. And if the pregnant woman is healthy, inshallah the children also will be healthy. So I think that's all from me. I think I will pass this discussion to my teammates. That's all from me. Thank you.
So, Assalamualaikum warahmatullahi wabarakatuh. My name is Nuruddin Safari, and today I'm going to present about the protection of mind. Okay, so the importance of protection of minds is firstly to differentiate human and other creature. Okay, Allah has give human a speciality which is we can think rationally compared to other creature such as animals and other things. Okay, so we need to protect our mind in order to have a rational thinking. Next is free human mind from any obstacle to iman, which is obstacles in believing in Allah. With protected mind also we can doing ibadah more perfectly. And lastly is to take care of our mental health, which could help us in preventing anxiety. Okay, so next we're going to discuss about protect things that can harm our mind, which is firstly drug. Drug can cause us to hallucinating that can do a lot of harm to our body and also to our mind. Next is smoking, zina, and also alcohol. Alcohol could make us to be drunk and also losing our rationality for a while. Okay, so this is some treatment that could help us to treat our body and also our mind if we take something that could harm our mind. Okay, so firstly is methadone rehabilitation, which is the treatment for drug addict. Okay, this methadone rehabilitation is a special treatment for person who already taken the drug and also addicted to the drug. Okay, it's medical counseling. Medical counseling could restore emotion and also intellectual function of a person. And last is repent to Allah. We could reflect our mistake and also ask for forgiveness to Allah. Okay, I think that's all from me. Thank you.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Nurfil Zahnadia binti Fazul Asman. My metric number is 2019296, and I will be presenting about the protection of wealth in medicine and Maqasid Shariah. Alright, so why is protection of wealth important? It is important due to the expensive medical care nowadays. So our healthcare system nowadays are becoming more pricey day by day, and this can be burdensome for some people. So why is it so expensive? Okay, the first one is because of the drug cost. The drug prices are expected to increase by 136% from 2010 to 2025, and it is increased about 10% annually. So the drug cost will keep increasing day by day, and this is why it is so expensive. And then next is due to the paid doctors and nurses and physicians. The average US family doctor earns over 200,000 a year, and specialists make over 300,000 per year. So we can actually see that from this, the US doctors are overpaid than in any other countries. Alright, the third point is due to the prices, they are very widely. This is due to the complexity of the medical system and also the lack of any set prices for medical services. This is due to the amount paid is actually very depending on the payer itself, whether the payer has insurance or government programs, and it also different depending on the geographical area. Alright, so the next point, why is it important, is due to our unhealthy lifestyle right now. Our lifestyle right now, it includes unhealthy diet and also unhealthy activities. So we can see from example is there are lots of viral restaurants or cafes nowadays, and what I can see that most of the viral ones, they include ridiculous amount of, for example, cheese or excessive amount of sweets in their menus, and this can lead to various heart diseases. The next one is due to the unhealthy activities. The prohibited activities in Islam can lead to various health issues. So prohibited activities are such as drinking alcohol or eating pork, and even prohibited relationship in Islam. So this may lead to diseases such as AIDS, hepatitis B, and also herpes. Alright, so next let us take a look at the US. So currently US is the most expensive healthcare in the world, and I have this video right here.
If you look at the data on physician visits and hospital discharges, you can get rid of one theory. Americans don't consume more healthcare than people in these other countries. We don't go to the doctor more than the Germans or the Japanese. In fact, we go to the doctor less. The difference between us and them is that we pay more. Every time we go to the doctor for everything from an angioplasty to a hip replacement, from a C-section to a pain reliever, in America, the price for the same procedure at the same hospital, it varies enormously depending on who is footing the bill. The price for someone with public insurance like Medicare or Medicaid is often the lowest price. These groups, they cover so many people that the government can demand lower prices from hospitals and doctors, and they get those lower prices. If the doctors and hospitals say no, they lose a ton of business. They lose all those people on Medicare, all those people on Medicaid. But there are hundreds of private insurance companies, and they each cover far fewer people than a Medicare or a Medicaid. And each one has to negotiate prices with hospitals and doctors on their own. And if you're uninsured, you have even less leverage. Nobody is negotiating on your behalf. So you end up paying the highest price. One study found that most hospitals charge uninsured patients 4 times as much as Medicare patients for an ER visit.
Go to the hospital less than other countries, but they paid more than other countries. The second one is that people without insurance, they paid 4 times more than people that have insurance. Okay, so that shows the importance of having insurance. And next, we'll be talking about takaful. So in Islam, wealthy protection can be made through takaful, which is the Islamic insurance. So takaful is an Islamic insurance where the members contribute money into a pool system to guarantee each other against loss or damage. They cooperate and helping each other in doing good deeds. We can take the Quran ayah here as an example. Bismillahirrahmanirrahim. وَتَعَاوَنُوا عَلَى الْبِرِّ وَالتَّقْوَى وَلَا تَعَاوَنُوا عَلَى الْإِثْمِ وَالْعُدْوَانِ وَاتَّقُوا اللَّهَ إِنَّ اللَّهَ شَدِيدُ الْعِقَابِ. And cooperate in righteousness and piety among others, but do not cooperate in sin and aggressions, which can lead to your own catastrophic. And fear Allah, indeed Allah is severe in penalty. Al-Ma'idah ayah 2. So this shows how takaful, which is an Islamic insurance, can help us to protect our wealth. So I think that is all from me. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Amir binti Abdullah. So I will proceed with the application of Maqasid Shariah in medicine. So the first application in Maqasid Shariah is the birth process. Before we proceed with the birth process in Maqasid Shariah, let's get known and familiar with these two terms, which are maslahah and mafsadah. What is actually meant by maslahah and mafsadah? For maslahah is meant by interest and benefit. It is also one of the goals of Maqasid Shariah. Meanwhile, for the mafsadah, Al-Sulami 2010 described a mafsadah as pain and sorrow. These two terms are very interconnected with each other and used in Maqasid Shariah because it will determine the decision for the problem that arises in a certain situation. Next, one of the aspects that are very important in birth process is the termination of birth. It can divide into two types, which are legal termination and illegal termination. For legal termination or termination of pregnancy is the situation where the doctor takes an action after considering the benefits and implication that may arise if the action is done. Complication or problem regarding to the pregnancy might happen from the first fertilization until the child is birthed. If the problem arises during this period and might harm the mother, it is legal to terminate the pregnancy. In Maqasid Shariah, it allows the thing that can give more benefits rather than harm. Next, for illegal termination, it usually called as abortion. Abortion is a crime done by irresponsible person that remove the fetus before the birth and throw the baby after the birth. This action can be considered as violent and immoral activity. Those people or the one who committed this action can be prosecuted. In Islam, this action is prohibited because it is not only give harm to the baby but also to the whole society. Allah subhanahu wa ta'ala said in Surah Al-Isra, ayat 33, with the meaning of, and do not kill the soul which Allah has forbidden, except by right, and whoever is killed unjustly, we have given his hair authority. But let him not exceed limits in the matter of taking life, indeed, he has been supported by law. From this ayah, we can learn that we cannot kill the soul unjustly, such as the action of abortion. But if we have the solid reason, after considering the benefit and harm, it's permitted to do the action, such as the termination of the pregnancy. Next, other aspect of birth process in Maqasid Shariah is the method of delivery. It comprises two ways of delivery, which are hospital delivery and also home birth. For hospital delivery, it uses the service from the doctors, whereas for the home birth, it uses the service from the doula. Doctor is a qualified person that responsible to treat the person who ill, but for the doula is a non-healthcare professional. Hospital delivery, it can give more benefits, which is maslahah, than harm, which is mafsadah, because the doctor has more experience and skill regarding to the problem or any situation that happened to the pregnant mother. Hence, in Maqasid Shariah, all considerations and decisions are made depends on its benefit and implication of an action. It is also to make sure it will give benefit and less harm to certain problems and situations that rise. Allah subhanahu wa ta'ala said in Surah Al-Mulk, ayah 2, with the meaning, He is the one who created death and life in order to test which of you is best in deeds, and He is the Almighty, all-forgiving. So, it depends on us on how we're going to use our effort, fitrah, and knowledge that Allah has given to us to deal with the problem in our daily life.
Assalamualaikum warahmatullahi wabarakatuh. My name is Alia, and I will discuss another application of Maqasid Shariah in medicine, which is vaccination. Vaccination is crucial to prevent infectious disease such as hepatitis B and polio. However, there is an issue rises in Malaysia that Muslim community rejects the vaccination due to non-halal ingredients in vaccine and irrelevant theories that saying that vaccination weaken our future umur. But by research and by learning more, we know that vaccination is permissible in Islam, based on Islamic legal maxims. The first of Islamic legal maxims is the preference of the lesser of two harms. When there is a clash of two harmful situations, we choose the lesser of the harmful situations. That means, although the consumption of vaccine may cause harm to some consumers, but it still needs to administer to reduce the greater consequence in the future. For example, pneumococcus bacterium. If we are not vaccinated, the pneumococcus bacterium will remain in our bodies, and it will expose more to the children, as the children's immune system are not matured enough. If the kindergarten have pneumococcal bacteria, it definitely will spread to the other children and make infections to the other children too. Thus, it will harm the society by spreading the disease. The next legal maxim is the necessity permits prohibitions. Means when one is in a situation that endangers one's life, the one whose life is threatened could do what in the normal circumstances prohibited to save his life. For example, MMR vaccine. MMR vaccine contains porcine gelatin, which is from pigs. Pigs is prohibited right in Islam. However, it can be permissible in form of rusa and in dire situation. In dire situation needs to be determined by the authoritative and trusted experts. And the last one is the ruler's decision is deducted in favor of the people. Every decision made by the ruler must be based on the beneficial aspects. The beneficial aspects means the benefits to the general public and not only a section of public. Example, the National Immunization Program. It is one of the initiatives of government which make the mandatory to the parents to provide the vaccination to their children. So, okay, there is this is the National Immunization Program schedule. This is the recent one. The government just changed in this year, if I'm not mistaken, from 5-in-1 vaccine to 6-in-1 vaccine. They improved by reduced injection to the babies, so that the babies will have less pain in the injection. And this is the type of vaccines: live attenuated vaccine, inactivated vaccine, recombinant vaccine, conjugate polysaccharide protein vaccine. I highlighted the inactivated vaccine because by my research, to produce inactivated vaccine, it required pancreas of pigs, which is porcine trypsin. it is prohibited in Islam, but based on Islamic legal principles that we discussed previously, it can be prohibited. It can be permissible in this situation. That's all from me. Thank you.
The number of patients suffering from end-stage organ failure increases every year. From this figure, we can see that there is a low rate of organ donations around the world. Further findings show that the current scenario, which is the inaccurate perception on organ donations from the religious point of view, especially among the Muslim community in Malaysia, contribute to this problem. This organ donation issue is crucial in ensuring Muslims in particular and the community in general. This awareness needs to be further instilled and nurtured. Giving up term does not exist in Islam, as Khalifah we must make use of their reasoning faculty given by Allah to treat illness and diseases. With the rapid development in modern medicine, various treatments have been discovered. One of the treatments is organ transplantation, which has proven to be successful in treating end-stage organ failure. The effort on curing illness is in accordance with the following hadith. Organ transplantation is to replace the unfunctional organ in a patient's body. These organs can be transplanted either from a living or deceased donor. The permissibility is not specifically mentioned in Quran and Hadith, as this is a modern development in medicine. The opinions of Islamic scholars regarding organ transplantation are ijtihadi, which is juristic interpretation in nature. A fatwa that is based on the ijtihad, as described by Dr. Yusuf Al-Qaradawi, is a fatwa that is still open for discussion because it is related to a new development that was not discussed by previous scholars. As we all know, all deeds are judged by their goal and purpose. The purpose of organ transplant is to save the patient's life rather than in intention of humiliating or organizing the deceased. Eliminating harm is one of the objectives of Islamic law. Organ transplant is an initiative to fulfill the objective of preserving human life in Maqasid Al Shariah. A great reward for the effort of preserving human life is promised by Allah subhanahu wa ta'ala. This is mentioned in the Quran as follows in Surah Al-Ma'idah verse 3, and whoever saves the life, it will be as if they saved all the humanity. Let us imagine if you are given two situations with different levels of harm. Priority is to avoid the greater harm by choosing the less harm. In terms of organ transplant, the greater harm is when the critical organ failure patient passes away. Therefore, in this situation, the lesser harm is given higher priority, which is donating organs from a deceased donor to be transplanted to the patient in need of that organ. In this context, preventing harm takes priority over preserving the body of the deceased. Organ transplant is a method to overcome hardship faced by a critical organ failure patient. This is supported by the following Quranic verse 2, ayat 185. Allah intends is for you, not hardship. As in Quran verse 2173, if one is an urgent situation to do the unlawful in order to eliminate the harm, it is permissible. To save a critical organ failure patient, the last option will be organ transplantation. When someone is facing unbearable situation, he or she is allowed to eliminate the harm. In terms of organ transplantation, a critical organ failure patient is facing the death. Thus, organ transplantation can preserve the human's life, which is one of the Maqasid Al Shariah purpose.
Assalamualaikum warahmatullahi wabarakatuh. I'm Saidatul Najiyah Shadan and I will be presenting on quarantine and Maqasid Shariah. So the movement control order, which has been established in our country, is parallel to the principle of Maqasid Shariah. So how are these two related, and how is the movement control order parallel to what has been suggested in the Shariah law? We will discuss this in the next slide. So the implementation of the movement control order is parallel to one of the principles of Maqasid Shariah, in which a specific harm is tolerated in order to prevent a more general one. Yutahammalud darar al-had lidaf'i darari am. For example, if conflict arises between the interests of an individual or a group of individuals and the whole community, prevalence should be given to the latter. This method explains that if the action taken could bring harm to the individual and the public, it is a must to take the action which would bring harm to only the individual in order to prevent harm to the public. In order to prevent the spread of virus, several methods are being established by the government. For example, we should all avoid crowded places, and we should avoid close contact settings where people have close range conversations, and also to avoid confined and enclosed spaces. And also, if you are feeling unwell, we are encouraged to stay at home and seek for medical care. So how are the movement control order related to the Maqasid Shariah? As we all know, Islamic law tends to preserve public interest rather than private, though it will cause some injury to the individual. The implementation of movement control order, for example, they encourage us to stay at home and just go out when we have some important things to do in order to prevent the spread of virus among the community. This is the same as what has been suggested in the Maqasid Shariah in order to prevent harm towards the community. And also the implementation of movement control order, for example wearing a mask and maintaining 1 meter distance between one another, could reduce the possibility of the spread of virus among the community, which is also the same as what has been suggested in Maqasid Shariah to preserve the community. And the Messenger of Allah had once said, anyone who causes hardship to people, Allah will do the same to him. As a Muslim, we should understand this ayah by obeying the law, the movement control order, what has been suggested by the government for us to stay at home and maintain the social distance, as we are not just obeying the movement control order rules, but also the rules of Maqasid Shariah as a Muslim. And as a conclusion, all of these steps are meaningless if the community does not understand the reason behind the rules established by the government. And as a Muslim, we must understand the role of Maqasid Shariah behind the rules implementation in order to maximize our effort in helping to reduce the spread of COVID-19. And as we can see, the movement control order is not just being implemented in our country and also in other countries as well. This shows that the Maqasid Shariah will not just give benefit to the Islam but also as a whole, the world. With that, I thank you.
Assalamualaikum everyone, I am Afisa. So I will continue the presentation with the 4 applications of Maqasid Shariah in medicine, which is plastic surgery. First of all, we need to know that there are 2 types of plastic surgery, which are reconstructive and cosmetic plastic surgery. For reconstructive, the purpose is to reconstruct a part of the body, restore the normal process. But for cosmetic, it focuses on the aesthetics of beauty. In a hadith, Prophet ﷺ, he said that, do not harm and do not reciprocate harm. This hadith is recorded by Ahmad, Ibn Majah, Al-Hakim and others. So as we can see here, Islam do not encourage us to do harm to ourselves and to others. Being in a surgery is a risk action because it can lead us to death. But in Islam, there is a certain condition where it is allowed because some reason. So we will discuss here. So plastic surgery and Islam. In Islam, conduction of plastic surgery with the purpose of changing one's appearance without medical necessity is legally prohibited because it doesn't have medical necessity. However, it only becomes lawful if a doctor or medical expert determines such procedure will result in either a physical or psychological benefit, especially for the one who will affect the stability of life in general and of marital life in particular. The surgery is also permissible for removing a congenital defect since birth and the ones that occurred later in life that acquired from accident or other reasons. Some Academy mentioned it is permissible to undergo a cosmetic plastic surgery when it is necessary and needed, and which is intended to 4 reasons. First one is to restore the shape of body's organ to the normal state, like normal people. Second one is to repair physical defects. Third one, to restore the normal function to the body organ, the normal process. And the fourth is to repair the circumstantial defects, which is not from birth. But it is not permissible to undergo cosmetic plastic surgery, which is without any medical necessity. When the surgery intended to gain beauty, to fulfill one's desire or imitate others to become more beautiful, or when the surgery intended to change face to deceive the systems. So, for reconstructive surgery, as we can see from the name itself, to reconstruct. So it is allowed in Islam because it is a medical necessity. Because without it, the patient might die or the normal function, normal appearance cannot be achieved. Reconstructive surgery also does not involve in changing the fitra, changing one appearance. This is the summary of plastic surgery and Maqasid Shariah. The reconstructive, it adheres protection of life and protection of progeny because it saves life and it allows reproductive function in human body. And for cosmetic, it's only adheres the protection of progeny because it allows people to gain beauty, so people can find couples. So, but it is against protection of wealth and protection of religion. Okay, it is very expensive. Protection of religion because when we do the cosmetic plastic surgery to gain beauty, we just the people is like not appreciating what Allah have give to them. Actually, they thought that Allah does not give the best for them. Allah gives the best for us, for every one of us. So in a nutshell, cosmetic surgery gives us more harm than benefits, and it is not a life-threatening situation where you needed the surgery so much. And just remember that beauty is very subjective to everyone, and Allah will only watch us, see us based on our taqwa. So for conclusion, Maqasid Syariah fi Atib is very important because we should always refer Maqasid Syariah in doing medicine based on these 5 protection of religion, life, progeny, mind, and wealth, to follow what Allah obligates us, and to sustain this world for the future generation. And we should always refer to Al-Quran and Sunnah, so we will not be the ignorance. One point that I want to stress in the conclusion, that everything is based on our intention. Only Allah knows about it. So I think that's all from us. This is our references that we referred in doing our video presentation. Thank you for watching. Assalamualaikum.